Hi, this is John Bernard from Kaiser University. Basically, we're going to speak about sleep disorders today. This is going to be our roadmap, the direction we're going to head through this PowerPoint show of about 21 slides, roughly about 15 minutes. When we talk about sleep disorders, it's basically a perpetual disengagement with an unresponsive engagement to the environment. We're looking at anything that wake you up, cause you health problems can be a problem of it. Um, the cause of health problems, you could be getting sick, as simple as that. Anxiety, depression, all these. We'll talk about this later on in the slideshow, but this is the alarming factor here. About 75% of Americans between the ages of 20 and 59 are having problems sleeping. With sleep disorders, you may experience fatigue during the day, difficulty falling asleep at night. With not requiring enough sleep, it's an unhealthy lifestyle. The energy and concentration needed to do day-to-day business actually is a negative in your life. Sleep disorders can be a sign of a person has a medical condition or maybe a mental issue, something you need to talk about. Even though these underlying cases and sleep disorders may go away, they may persist later on in life. Maybe something that may be needed to be corrected by lifestyle change or it's prescription medication. Of course, there are a variation of sleep disorders and severity types. Here's a list of some of the most common. We've talked about a few of these here. We're going to discuss a few of the sleep disorders that may be caused by health issues, allergies, respiratory problems. This also includes asthma, not being able to obtain enough oxygen. You'll see this when we talk about sleep apnea. The body is uncomfortable. It goes into survival mode, and it's constantly going to keep you awake while you're trying to breathe, basically. Nocturnia basically is a frequent urination problem. Could be anywhere from drinking too much, alcoholism, hormone imbalances. All of these can be a benefactor to sleep disorders. This also includes chronic pain, something that is a constant pain, difficulty falling asleep. I'm sure somewhere in your life you sprained an ankle, broke a bone, did something, and it's causing you pain. You hit those pressure points, and those pressure points release. Some of the most common are arthritis, chronic fatigue, fibromyalgia, inflammatory bowel system, persistent headaches, lower back. Any one of these things can make it very difficult for you to sleep. Stress and anxiety is a part of life. Sometimes we just can't turn it off. There's just some things in our life that affect us that cause us not to be able to go to sleep. It's fairly simple. It's just not simple to get rid of. If we look at the ICSD, it lists 81 major sleep disorders in 8 categories. Here's the 8 categories, kind of breaking it down a little bit simpler for us to kind of understand and how they fall into this roadmap of sleep disorders. Insomnia in itself, if we take a look at insomnia, this could be as easy as jet lag, time change. You ate something that disagreed with your system. Any one of these things can cause insomnia, like we talked about before. Stress can cause insomnia. The problem with insomnia is that if it continues, we can see depression, difficulty concentrating, irritability, weight gain, not being able to perform. This also makes us forget things. Basically, insomnia is broken down into 3 groups. Characteristic are often experienced. You have chronic insomnia. It's daily more than a month. intermediate, different episodes, breaking it up, maybe once a week, twice a week, and then transient, lasts several nights at a time, where it's lasting 2 or 3 days during that week. Each one of these will affect our health values, our wellness. Let's look at sleep apnea. Basically, sleep apnea is you stop breathing in the middle of your sleep. The body is a survival mechanism, and when you stop breathing less oxygen, what will happen is you'll be awakened. This happens a lot with PTSD. Can happen in different breathing disorders. There's a couple other mental disorders that this can follow. It goes into full study with Sawyer and Weaver. Take a look at parasinomas. Abnormal movements and behavior during sleep. These include sleepwalking, sleep talking, which will get you in trouble, groaning, nightmares, bedwetting, usually in the juvenile area, grinding teeth or jaw clenching. These are all, of course, sleep disorders, but these are things that you're doing while you're sleeping. You don't even realize it. Some of them are quite dangerous. Sleepwalking in itself is extremely dangerous. Not knowing where you're going, you can run right down a set of stairs. Or better yet, try to put a quarter into a tree like one of my students did while we were on patrol, trying to get a drink out of a tree. Lack of sleep can cause a lot of problems. When we look at restless leg syndrome, we normally would correlate that with ADHD and Parkinson's disease. A tingling in the legs that can happen during the daytime, but most of the time it happens when the body's trying to go into rest mode. Narcolepsy, I have only seen this once in my life, but apparently people that are going through here always feel extremely tired, and basically can, while standing up, can pass out and go to sleep in the middle of a conversation. The first time it happened to me, it was quite scary. What was even scarier about this is that when I woke the soldier up, it was like he never missed a spot in the conversation, and kind of delusional at the point in time. Of course, we seeked medical attention, and he was okay afterwards, after they figured out he had narcolepsy. When we talk about disorders and diagnosis, there's a couple tests that can be done. Physical exam, of course, mental exams can be done, along with polysomnographic and an EKG, of course, because I'll stumble over that word. We'll talk a little bit more in depth about each one of those, and then, of course, the genetic blood testing for narcolepsy and other conditions that might be affecting your quality of sleep. When you talk about a polysomnographic, basically you're being observed by a doctor. They're going to hook up electrodes, oxygen measurements. They want to see how much oxygen you're pulling in. They're going to check your brain waves, your skeletal muscle activity, your heart rate, breathing rate, eye movement. And this gives them a full diagnostic ability to take a look at all the different things that are going on with you during sleep. It doesn't answer all the questions, but it basically puts out a good foundation. One of the big things is it talks about REM, is what I want you to get out of this, REM and non-REM. About every 90 minutes for those without sleep disorder, between 90 and 120 minutes, there's going to be these cycles of sleep during the night. Basically, they're looking at what's going to interrupt these cycles and where they're at. Here are some of the reasons why it may be ordered by medical physicians, and they're going to check sleep apnea to see if it's elevated, and any of the other things that may be included. Now, sleep apnea itself, despite having rested, ongoing loud snoring, periods of your breath, holding your breath during sleep or gasp for air, frequent episodes of waking up during the night, restless sleep. I actually suffer from sleep apnea and have woken up completely disillusional and my heart racing through my chest. This can be a very scary situation. Of course, we talked about REM already, sleep-related seizure disorders, narcolepsy. One of the biggest things here, when preparing for this test, you want to avoid alcohol, caffeine, and sedatives. Let's talk about EEG. Basically, you're going to be hooked up with electrodes across the scalp, and it's going to take brain impulse. It can help detect potential problems associated with this activity. This is basically a list of determinational brain disorders: seizure, head injuries, brain tumor, memory problems, sleep disorder, stroke, dementia, to cover just a few. A lot of the guys that are coming back from overseas, that are having PTSD, that have been involved in an explosion, this is one of the tests that they'll perform, to include MTBI and TBI. Like the slide states, basically a combination between medical treatments, lifestyle changes is a typical use to the benefit of the patient. Medical treatments can include sleeping pills, melatonin supplements, medications, breathing devices or surgery, dental guards for grinding your jaw. The biggest thing here also is that, remember this, if there's alcohol as one of those issues, you are lowering your melatonin by almost 25% right off the bat. Alcoholics can lower it even more. Your body produces a natural sleep agent of melatonin, but if you're an alcoholic, one of these things are not going to happen for you. This list here basically describes my life. Having sleep disorders because of PTSD and MTBI, a lot of things I had to do to stay away from having to be overdosed on medications and sleeping machines and everything else that come along with it. I am now intaking more vegetables, white meats, fish, stuff like that. I stay on a very high exercise program to help reduce my stress and anxiety. As much as I possibly can, I try to keep the same sleeping hours. In the condition I'm in right now, it's really hard to do that where I'm working. I don't consume as much water, reduce the caffeine only to a very early time in the morning unless I have to do night mission. And my meals consist of about 6 meals a day right now. I eat in small meal package. If you were to do the paleo or the keto diet, something like that, that helps me stay in track. As you can see from the slide, what we're looking at is basically just changing your lifestyle to make it healthier. Getting away from the alcohol, getting away from the tobacco. That was probably one of the hardest things to do. Some other things that can be used while we're looking through the references real quick here. Meditation programs, yoga. Don't overlook these things. They fulfill a lot of relaxation. They allow you to let go of things. I'd bid you to go out and do some research and take a really good look at some of the stuff that is out there, something that would help you. Just got turned on to some meditation tapes and some sleeping tapes by one of my fellow students. They were great. They're working out awesome. Basically stories, light music back behind it, allowing you to go to sleep. Hope you all picked up something out of this. and have a great day.